ex-minister Andhra Pradesh. Yesterday I visited Srikakulam city where a number of people hit because of a diarrheal outbreak and 4 persons died because of this diarrheal outbreak. Day before yesterday I visited Rajahmundry where around 5 to 6 people died of acute kidney failure due to adulterated milk consumption. These are the kinds of news which is very common in our Andhra Pradesh since the onset of this alliance government. If you go back, nearing about 13 people died of a diarrheal outbreak in Gurla Mandal, Vijayanagar district in 2004 December. 18 people died because of contaminated water consumption in Turakapalam village in Guntur district. Nearing about 6 people died of another diarrheal outbreak in Vijayawada city. Similarly, according to the government data, there are 61 instances of waterborne diarrheal instances in Andhra Pradesh since the onset of this alliance government, that's nearing about 20 months. Out of the 61 instances, nearly about 34 to 35 incidences occurred in school-going children, hostel children, like BC hostels, SC welfare hostels, ST hostels. 35 incidences occurred in government institutions only. My idea is, every time our Chief Minister Chandrababu Naidu speaks about brand AP image, he discusses about quantum computers every time. He always speaks about artificial intelligence. And he is very much interested in making MOUs with the companies in the respective sectors. But the true image is, yesterday I found one news in newspaper, one farmer, he is bringing his wife as a patient on his own bullock cart. Why? Because the 108 ambulance is not available. A farmer bringing his sick wife to the hospital on a bullock cart. That is the true scenario in Andhra Pradesh. Tribal men taking their sick patients by dolly because the ambulance itself is sick in tribal areas. That is the true scenario. Where are we going? What are all these government institutes are doing? I don't understand. The entire public health sector is sick in Andhra Pradesh. The MLAs, ministers are playing kabaddi at this time of precious situation. New Year cases are reporting in Srikakulam city. The diarrheal outbreak is being exposed to newer areas now. Even in Rajahmundry also, consumption of milk, consumption of adulterated milk. We don't know the exact details even now. It's been already 1 week. Almost 6 people died. Maybe in the coming days, 3 more patients may die because they are already on ventilator. Continuous dialysis. In Srikakulam also, a number of patients are severely hypotensive. They are in shock even now. Maybe the casualties will be increasing. But still now, the government action is not appropriate. It's not at all appropriate. Even now they are not distributing clean water to the affected areas or the affected families. Even now, the people are really worrying about. They are coming onto the roads. They are literally questioning the public representatives. That is the true image of Andhra Pradesh. That is the true, brand AP image. Chandrababu Naidu garu is trying to disrupt the spread of this kind of news by his own media. This kind of news are not at all coming to the public. I request the government of Andhra Pradesh, the concerned aligned departments, what are you doing? I don't understand. 61 instances of diarrheal outbreaks in Andhra Pradesh. In like major cities like Vijayawada, Srikakulam, Guntur. What's happening in Andhra Pradesh? Can you report a single instance like this in Jagannath Reddy Garu regime? Can you show me one such instance? Not only like this waterborne diarrheal outbreaks, even in government hostels. Can you show me one instance? That is how our former Chief Minister Jagannath Reddy Garu did the administration. Even during the times of Corona also, he worked like a doctor, a social doctor. The administration during Corona times is an exemplary to the nation. But today in Andhra Pradesh, a small street affecting with this kind of epidemic, n number of people are being died. That is the level of tertiary care or secondary care they are giving. Preventive measures, primary health care, anyhow it is sick. The secondary hospitals like community health centers, they are all being given on PPP basis now. The tertiary care offering medical colleges, they are also being given to the private people now. Entire medical and health department in Andhra Pradesh is being privatized and it's being locked down. Let the government awake. Let the government stand up to the situation, live up to the situation. Try to form some teams, surveillance teams, preventive measures, clean water to the affected area at least. Give some better tertiary care such that mortality is being low. Is it happening even in very underdeveloped countries like even African countries? It is not possible. People are dying of diarrhea in Andhra Pradesh. The people are dying of diarrhea. People are dying after consumption of milk. What's this? That is the real scenario. Chandrababu Naidu garu, please come to the reality situation. Please come to the reality. Try to visit the affected areas. Then you will understand what is the real scenario. We never experienced this kind of scenarios in our regime, in our Jagannath Reddy Garu's regime. Why all these are happening now only? Come to the reality, please. Thank you.